Hi everybody, Dr. Cary here, just working on some video edits from our webinar, which was last week, called Understanding and Treating Headaches and Facial Pain. I hope you enjoy these edits. It was a highly watched YouTube video, and I'm going to give you some shorter clips so you can watch the individual slides here on social media and on YouTube. If you're interested in becoming a patient in our clinic, please click on the link in the bio or the show notes below. We're accepting new patients. If you're not in the Kelowna area, you can click on the link to our consulting website. We'd be happy to help you with some health coaching, as well as direct you to a chiropractor in the area that does this type of work. In the Kelowna area, then you can always reach out to me. You can message me here or send me a DM, and I'll try and find a chiropractor in your area. I've done that for many people in Toronto, Saskatchewan, Vancouver, Victoria, the US, Palm Springs, LA, places like that. So I'll find a chiropractor for you that does a similar technique to what we were talking about today. Just going to close this window. I'll open this one. Of headaches. Some of the headaches that people have are tension headaches, migraine headaches, cluster headaches, sinus headaches, and rebound headaches. So now you've probably heard of 2 or 3 of these, and maybe you've even experienced something like this. I know I have. I've had tension headaches before. I've also had migraine headaches as well. So tension headaches are described as the most common type of headache. They're characterized by a dull aching pain across the forehead, the temples, the back of the head or neck. And usually they're a result of stress or tension, tightness building up in this area. This can also lead to a sensitivity to sound and light, and it can cause mild to moderate pain in this area. Some other causes of tension headaches are muscle tension. So let's say there's imbalances in the muscle and the alignment in the neck area, poor posture, and even anxiety. Migraine headaches, these are intense throbbing headaches that can last for hours or even days and often affect one side of the head. The symptoms include severe pain, nausea, vomiting, sensitivity to light, sound, and sometimes smell with visual disturbances. So some people experience like an aura, like a flashing light, and this can lead to the migraine, the start of the migraine and then intensifying after that. Some of the causes: genetic factors, hormonal changes, certain foods and drinks, stress, and sensory stimuli. Like sometimes a bright light can trigger a migraine. Cluster headaches, these are severe headaches that occur in cyclical patterns or clusters, often waking individuals from sleep. The symptoms are intense pain around one eye or another eye, one or the other eye, and red or watery eyes, nasal congestion, and restlessness. The cause is unknown, but it might involve the hypothalamus, which is a part of your brain, deep in your brain, seasonal changes, and genetic factors. The 4th type of headache we talked about, sinus headaches, are associated with sinus infections, sinusitis, causing pain and pressure in the sinus area. Symptoms can involve pain in the forehead, cheeks, eyes, nasal congestion, runny nose, and fever. And usually this is caused by allergies, sinus infections, inflammation of the sinuses. And there's a few sinuses in the skull cavity. 2 of them are right here on either side of the nose. There's 2 on the top above the eyes as well, called the frontal sinuses right up here. There's some mastoid sinuses behind the ears right here as well. So they're all, there's a number of sinuses in the skull region, and if these get filled with fluid, it can cause a lot of pressure and a headache. The last type we talked about, the rebound headache, this can be caused by medication overuse, and this can lead to a cycle of frequent headaches. These can cause daily headaches, often starting early in the morning, varying in type and intensity, and this can be a result of overuse of certain medications like aspirin, acetaminophen, triptans, and can cause different types of headache symptoms. So those are the 5. I've seen results here in the clinic, especially with tension headaches, migraine headaches, and sinus type of headaches. We haven't had a lot of cluster headaches and rebound headaches are due to medications. So those are treated differently. Now, the causes of most headaches can be traced back to the factors we talked about just now, but can also be a result of other types